Good day, folks. Thank you for joining us here at Your Health. On today's program, we want to get you up to date on vitamin D. Are you taking full advantage of this health-promoting sunshine nutrient? If you're not taking vitamin D, please watch today. This program, what you learn from it, could spare you much misery. And it just happens to be vitamin D is the cheapest vitamin to take. So this is a win-win. No reason not to take it. That's our program for today. Vitamin D updates, the newest scientific information on this wonderful vitamin. But first, let's go to our news. Let's see what's happening in the health world. Persistent and chronic pain affects almost 40 million Americans. Researchers report in the Journal of Pain that 19% of all Americans have frequent or constant pain lasting longer than 3 months that affects their quality of life. The study also found those in chronic pain are much more likely to have anxiety, depression, or fatigue. The researchers used data from the National Health Interview Survey to make their findings. Related research from the Journals of Gerontology finds as the blood's level of vitamin D decreases, the risk of developing chronic pain increases in men. And from research published in the journal Rheumatology International, researchers find a low vitamin D level greatly increases the risk of women developing chronic widespread pain syndromes. Low vitamin D levels increase the risk of chronic and persistent widespread pain in both men and women. Now, this discovery will most certainly improve the lives of millions of Americans. However, mainstream medicine and your evening news will not be telling you of this life-changing research. To learn of these things, you must take charge of your own health and find answers on your own. And watching this program is a good start. If you are living in chronic pain, it is my advice to you to engage in a complete holistic health makeover. The plan should include an exercise program to gently build strength and flexibility without causing re-injury. You should also change the way you eat. An organic garden and farm-fresh Mediterranean-style diet, low in sugar and refined starches, can do for you what no drug can. A wisely selected dietary supplement plan will help you rebuild damaged and inflamed tissues while soothing achy joints. Better than any anti-inflammatory drug because they do so without side effects. Your plan should also include all the necessary vitamins and minerals at abundant levels, with emphasis on magnesium, the omega-3 fatty acids, and vitamin C. Include agents such as glucosamine, boswellia, curcumin, and noni juice to calm inflammation. And as our report finds, include higher levels of vitamin D, as this wondrous agent acts as an overseer that coordinates the repair and daily function of our entire body. The typical adult vitamin D3 dose ranges from 3,000 international units daily for a small person to 8,000 for a tall and large person. Our goal is to maintain a vitamin D blood level of around 50 nanograms per milliliters. Taking vitamin D supplements or increasing sun exposure may improve asthma. Researchers from Tel Aviv University reviewed health data on over 4 million subjects. The vitamin D blood levels of some 300,000 of these were analyzed. Of these, some 21,000 had asthma. They found if the asthma sufferer had low vitamin D levels, they were 25% more likely to have frequent asthma attacks. Related research published in the Journal of the American Medical Association finds for every 10 nanogram milliliter increase of the blood's level of vitamin D, the risk of asthma treatment failures decreases by 80%. Well, folks, it's becoming increasingly clear that if you have asthma and your blood's level of vitamin D drops to an abnormally low level, your asthma will become dangerously difficult to manage. On the other hand, if you supplement vitamin D to raise your level, you will find that breathing becomes easier. Now, we have several other vitamin D studies that could help our viewers. First, from the American Association of Neuromuscular and Electrodiagnostic Medicine, we learned that vitamin D deficiency is common among those with neuromuscular diseases such as multiple sclerosis, myasthenia gravis, and Parkinson's disease. They also found vitamin D supplementation helps to improve the daily function among those with neuromuscular diseases. And from St. Michael's Hospital, reported in the Canadian Medical Association Journal, children who drink non-vitamin D fortified milk such as rice, almond, soy, or goat's milk are twice as likely to have low vitamin D blood levels. And finally, from the University of Edinburgh, researchers find from an animal study, if those who are overweight and have prediabetes supplement vitamin D, it may help them lose weight and lower their chances of developing diabetes. Well, folks, today on Your Health, we'd like to discuss the amazing health benefits of vitamin D. Please understand that 4 out of 5 Americans still have tragically low levels of this health-promoting nutrient. And we have the newest findings on vitamin D when we return.
I'm Cindy Becker.
And I'm Dr. Richard Becker. Are you thinking about your health as we approach a new year? Well, many of us do, even though our health is important every day of the year.
If you have a wellness plan in mind, December's a month with special holiday prices. Plus, shipping within the continental U.S. is free for all orders over $50.
We'd like to thank you for your continued support. It's because of you that we are able to provide this great educational service.
So call us today to restock your supplements for the coming year and tell a friend about the savings, or order online at bioinnovations.net for the best prices of the season.
We hope the new year brings you happiness and better health for your entire family. Merry Christmas.
And a happy, healthy new year. I'm Cindy Becker for Your Health at a Glance. Are you looking for a healthy replacement for sodas? For thousands of years, the Far East has enjoyed the many health benefits of green tea. Now the Western world has embraced this potent antioxidant for its many health benefits as both a drink and supplement. Green tea has been thoroughly researched. It's been shown to improve bone density and immunity, as well as levels of cholesterol, blood sugar, and blood pressure. Research has also shown it to decrease inflammation and one's risk of cardiovascular disease and many forms of cancer. One recent study even found that people who drink 5 or more cups a day were 33% less likely to develop conditions that cause disability. For health, it is everyone's cup of tea. For Your Health at a Glance, I'm Cindy Becker.
Have you heard of Cordyceps sinensis, the medicinal mushroom that supports metabolic processes for stimulant-free energy? This remarkable mushroom also supports the immune and respiratory systems, as well as the heart and lungs.
BioInnovations brings you Dr. Becker's Bionutrients, Cordyceps sinensis.
Medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems. And Cordyceps sinensis is among the safest and most powerful medicinal mushrooms available today, making it your choice for stimulant-free natural energy.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Be sure to ask about the auto ship program for additional savings. Welcome back, everyone. It is such a blessing to be with you this blessed holiday season. And I've got to tell you what a great time of year it is, isn't it? Well, today we're going to be talking about vitamin D. Did you know that 4 out of 5 Americans still aren't getting enough vitamin D? This is just amazing. And Richard, you know, vitamin D, we used to think we relied upon the sun to get that.
Yes. And, you know, if we're out in the sun a lot, it increases our risk of skin cancer, and we don't want that to happen. And right. Tanning beds, the same type of thing. So the smart way to get your D is by supplementation.
Right.
Yeah. This really is a fascinating subject, and it's a tragic subject in the sense that so many Americans, the vast majority, 4 out of 5, are not taking advantage of this life-changing, pain-sparing, disease-sparing research that we know about vitamin D. It's also our cheapest vitamin to supplement. There's really no reason not to. Very few people should not take vitamin D, and we'll clarify that in the program. But let's talk about vitamin D. What is it? Well, it's a fat-soluble vitamin that helps us to absorb and control the minerals calcium, magnesium, iron, phosphorus, and zinc, and to deposit calcium and appropriate minerals into our bone. This we've known a long time, but it also controls the growth of cells and regulates our immune system. Vitamin D is also a hormone that regulates other hormones. The body can make it from sunlight and a cholesterol derivative compound called 7-dihydrocholesterol in the skin that can be converted with ultraviolet B into vitamin D. This dual function has made vitamin D physiology quite complex and has delayed our understanding and discovery of vitamin D. Dietary and self-made vitamin D is inactive. It must be processed by the liver and the kidney into calcitriol, or 125 dihydroxycholecalciferol, before it can do its very jobs. It's complicated, and it takes some effort to come to understand this. And I think it's intimidating to patient and doctor alike to come to understand vitamin D's role. Vitamin D2, what we call D2, is made by plants. It's your vegan source, and that may be appealing to vegans. However, it's not very effective. And studies have shown vitamin D3, made by animals, is up to 87% more potent. It's also the form that study shows the vitamin D3 linked to decreased death risk from all causes. Let me state this simply. You take vitamin D3, your risk of dying today is lower. Tomorrow is lower. Next year is lower. Your risk of death from any reason is reduced. That's impressive and worth the effort to know that. Both vitamin D2 and D3 are converted to the active form of vitamin D, which is 125 dihydroxycholecalciferol. But that is not the storage form. We store it as 25-hydroxycholecalciferol, and we also test for that. So if you want to know what form of vitamin D do we test in the bloodstream, it's 25-hydroxycholecalciferol. That's what we do to find your blood's level, and we will refer to that frequently. You don't need to know any of this, really. Well, the most important thing about it is to know how much you should take, and we will also get to that. When vitamin D is made the natural way, it's made from sun exposure to our skin, and we regulate the amount of vitamin D we produce. When we supplement vitamin D, we negate those controls, so it's important that we know something about how to do this so we can do it safely. Well, what's the state of vitamin D in America? It's confused. It is confusing due to this complexity. A number of factors have created confusion regarding vitamin D and health benefits. The aforementioned dual function as both a vitamin and a hormone. The scientists use different units of measure, international units, micrograms, nanograms, nanomoles. It's a mess. It's hard to follow all that. It's both present in nature and in our diet and in dietary supplements. When you conduct a study, it's hard to tell people. It would be unethical to tell the control group, you don't get any vitamin D at all, because we know if we prolong that, these people will die. So to know its true effect on us, we have to do some extrapolation to understand, because even the control groups are getting vitamin D. But there is undeniable evidence now, folks, that the vast majority of Americans and people around the world are deficient in vitamin D. The biggest controversy lies not in whether we should supplement vitamin D, but to what degree and how much. The majority of studies that do not confirm vitamin D's benefit use too low a dose for too short of a time. Make sense? Some of these studies are designed to fail. They're designed to show that vitamin D doesn't work. When you give an appropriate dose, it does work in most instances. For example, the Institute of Medicine. This is an institute that is paid for by your tax dollars. They still recommend that adults only take 600 international units a day. That is just enough to prevent rickets and chondromalacia in adults, but it's not enough to prevent cancer and the other diseases. Elderly patients, according to the Institutes of Medicine, 800 a day. This is only partial benefits. We can do much better than that. Vitamin D experts say that we need between 3,000 and 8,000 units of vitamin D3 every single day. One easy way to determine your required dose of vitamin D is do it by pounds. Take 30 to 35 international units per pound every day. If you're 100 pounds, that'd be 3 to 3,500 international units. You can do the math, from 30 to 35 international units per pound per day. We can also do that in kilograms. Now, how shall we define vitamin D deficiency? In the past, it was below 10 nanograms. Then it was raised to 20. Then it's up to 34, and then some say 40. You will find varying definitions of deficiency and suboptimal states. Above 40 is what I consider optimal, and many experts as well. Below 34 is insufficient, and below 20 is deficient. That's how we will work today. Those are the parameters we work with. Above 40 is optimal. I like to target near 50. Okay? Below 34 is insufficient. Below 20 is deficient. Get this, only 10% of us have sufficient levels above that 34. Only 1 out of 10. Levels as low as 10 nanograms per deciliter will prevent rickets of Australasia, but will not protect against our most common causes of death. And please understand that neither rickets or osteomalacia is common in the United States today. They do happen, but not nearly on the order of heart disease and cancer and autoimmune disease. As we discuss what is optimal for vitamin D levels, inevitably we come to the conclusion that we should study man and woman, humankind in their natural state. And I want you to know that this study has been done. It's called the Hawaiian Professional Surfer Study. What a better way to find out what our vitamin D levels should be. Here we have people who are on the water in a tropical region more days than not. Surely they have high and robust levels of vitamin D. Well, the study was done and they surveyed some 2,000 or more professional surfers and surf instructors, and they found their average vitamin D level was only 27. That's not even sufficient. And there's a reason why this happens. They cover up in the sun, just like you and I do. They put things on, they put on sunscreen, and they tan very darkly. All of these block the production of vitamin D in our systems. So we will have to depend on scientific research to know where we should be with vitamin D. Studying man in its native state isn't going to tell us. It doesn't go high enough. We already know that 27 is not enough. Well, let's look at the facts before we go to the break. Who is likely to be insufficient or deficient? Boston University says 82% of us are insufficient or deficient, 80% of nursing homes, 70% of psychogeriatric patients, meaning those with dementia, Parkinson's disease, the neurodegenerative disorders. These are very likely to be low in vitamin D. It's hard to get out in that type of situation, get sun exposure. 92% of all children are low in vitamin D, especially those who are formula-fed infants. 1 quart of formula only contains 400 international units, what a baby should get. But when a baby is ingesting 1 liter or 1 quart of formula a day, it's time to wean the baby. So in practicality, they never get that 400 international units a day unless mother is sunbathing the child, and that's a practice that we've abandoned. Who else? Dark-complected people. 95% of nursing home African-American resident Americans are vitamin D deficient. 85% of senior African-American who care for themselves are deficient. If you live above LA to Atlanta, that line that goes across the southern part of this great nation, if you live above that level, you are highly likely to be profoundly deficient. And if you live below it, you're only about 50% likely to have enough, okay? Those who wear sunscreen are low in vitamin D. Those who work indoors, those who eat very little dairy, have malabsorptive issues or chronic diarrhea. The obese and those with hyperparathyroidism are probably quite low in vitamin D. And those taking certain medications, these are very important. Pay attention to see if you're on one of these medicines. Any type of steroid, whether it's inhaled, swallowed, injected, or applied to the skin, depletes vitamin D profoundly. If you're on chemotherapy for cancer, if you're on barbiturates or phenytoin to control seizures, you're probably low. Rifampin isoniazid for tuberculosis treatment, you're low. Cholestyramine and cholesterol for cholesterol management, you're probably low. And mineral oil and orlistat or Alai for weight loss. There are others, but check your medicines to be sure you're not profoundly low. Let's go to our break, and we'll talk about, are there really dangers to taking too much vitamin D? We may shatter a myth when we return. We'll be right back. Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient. Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
BioInnovations brings you Dr. Becker's Bionutrients Vitamin D3. Now, supplementing with vitamin D is safe and affordable.
Studies show that vitamin D deficiency can lead to poor immune function, depression, cardiovascular disease, bone disease, diabetes, cancer, and much more. Starting supplementing vitamin D today for better health tomorrow.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. I'm Cindy Becker, and this is Your Health at a Glance. Are you following a low-fat diet? While it's true that too much fat makes us overweight, certain types of fat are actually good for us. Add to your diet omega-3 fats such as fish and flaxseed oil, and omega-9 oleic acid found in olive oil. And reduce in your diet omega-6 found in corn, safflower, and peanut oil, and saturated fats found in meats and whole milk dairy products. Studies show those fats can promote inflammation and chronic disease. The Mediterranean diet can help you make good choices, such as fruits, vegetables, whole grains, lean meats, fish, olives, and olive oil. So remember, increase omega-3 and omega-9 fats. Reduce omega-6 and saturated fat. For Your Health at a Glance, I'm Cindy Becker. Hello, I'm Cindy Becker.
And I'm Dr. Richard Becker. Are you thinking about your health as we approach a new year? Well, many of us do, even though our health is important every day of the year.
If you have a wellness plan in mind, December's a month with special holiday prices. Plus, shipping within the continental U.S. is free for all orders over $50.
We'd like to thank you for your continued support. It's because of you that we are able to provide this great educational service.
So call us today to restock your supplements for the coming year and tell a friend about the savings, or order online at bioinnovations.net for the best prices of the season.
We hope the new year brings you happiness and better health for your entire family. Merry Christmas.
And a happy, healthy new year. Back, everyone, talking about the importance of supplementing with vitamin D, especially vitamin D3. That's the one way I like to take it. So we've talked about we need to have it. We need to take more than we're told we need to take by the powers that be. But can you get too much? So, yes. Richard, is there a point where it's toxic, or, you know, there's an amount that you shouldn't take?
Yes, vitamin D is a fat-soluble vitamin, and that means we will store it when we take exceedingly high amounts. At 80 nanograms per milliliter, we begin to raise the blood's calcium level. And at 100 nanograms per milliliter, we begin to see atrial fibrillation, and it can go all the way up to hypercalcemia, too much calcium in the blood, and can lead to seizures and death. But this is extremely high levels. To attain a blood level of 80 nanograms, you would have to take 40,000 units a day, every single day, of vitamin D3. That is really high. You know, this attitude, this fear, means that most people take too little and for too short of a time. And if you have, your blood level is up where you want it at 50, let's say, and you stop within a month, you'll be down to deficient levels, okay? Now, let me give you an idea here. Let's say, again, you're at 50, and you forget you took your vitamin D and you took an extra 1,000. How high would that spike it? It would only raise it to 55 nanograms, and it would only do it for about a day, okay? Many studies now are starting their study with an initial dose of 100,000 to 500,000 international units of vitamin D3, done safely, and then a daily dose. They don't want to take 3 months of study time to raise the value to the level they want to investigate. They want to hit it quick, and they'll give 100,000 to 500. This is common now, 100,000 to 500,000 international units of vitamin D3, one time only to start, and then your daily dose based on that 30 to 35 units per pound per day. Does that make sense to everybody? So our body gives us a buffer system. The higher our blood level, the more it takes to raise it up a few. If you are at, say, 80 nanograms and you take an extra 1,000, it only raises it 2 points. Does that make sense? So the more you take, it's not a linear relationship. It's more like a ski slope. Okay, let's talk a little bit about the benefits of vitamin D. This is so important. Vitamin D, a study from Great Britain, vitamin D insufficiency raises all causes of death by 75%. We're talking about levels above 34 give you this protection, below 34, 75% increased risk of death. Boston University finds vitamin D significantly affects 291 genes tied to 160 metabolic pathways that affect whether you're going to have cancer, autoimmune disease, diabetes, cardiovascular disease, and hormonal system abnormalities. This is profound. 291 genes, 160 metabolic pathways, and vitamin D has an epigenetic effect. It can unlock your genetic code for wellness, or it can activate genes that you inherited towards disease if you don't have enough of it. Okay? Cancer support, perhaps vitamin D's greatest effect. A huge Norwegian study on cancer survival in vitamin D, they found those who had levels above 34 were 63% more likely to survive breast cancer, 60% more likely to survive colorectal cancer, 67% more likely to survive leukemias and lymphomas, 81% more likely to survive lung cancer, and 76% more likely to survive prostate cancer. A Canadian study, above 34, reduced head and neck cancers, deaths by 15%. A British study, an 8-point D increase. Every 8 points you raise your vitamin D level, 17% reduced risk of melanoma death. You know, if we just stop there, it'd be in all our interest to take vitamin D every day, but there's so much more. Let's continue. Breast cancer. The typical U.S. breast cancer patient has a vitamin D level of 17, tragically low by everyone's definition. 70% of breast cancer patients have low D levels. The average is 17. An Australian study found vitamin D insufficiency increases your risk of death from breast cancer by 250%. 2.5 times more likely to die if you're a breast cancer patient if you're low in D. Vitamin D supplementation lowers muscle and joint pain during chemotherapy for breast cancer. If you do develop breast cancer and your blood level of vitamin D is up above that 34, closer to 50, you're 60% more likely to survive 5 years than those who do not supplement vitamin D. This is a huge benefit. Colorectal cancer deficiency of vitamin D suppresses the immune proteins that stop the progression of colon cancer. It stops the progression of polyps into colon cancer. This is a major reason why we develop colon cancer. We have these abnormal cells develop into polyps and on into cancer. If your vitamin D level is high, it helps to stop that process at the root cause. Lung cancer. Big study in Denmark, low vitamin D levels tied to significantly higher risk of tobacco-related cancer deaths. Cancers of the lung, bladder, esophagus, uterine cervix, head and neck, kidney, liver, pancreatic, stomach, and myeloid leukemia. These are all the cancers associated with tobacco use. Your risk of dying from these increases greatly if you have low vitamin D levels. Lymphomas, leukemias, deficiency tied to a 40% higher mortality rate from large B-cell lymphoma. And if you are low in vitamin D with the lymphomas, you get more aggressive cell types, more likely to die with a more aggressive cancer. Those with chronic lymphocytic leukemia or CLL and vitamin D deficiency, twice the risk of death, progression on to death. Prostate. Harvard University, those with high vitamin D levels were 57% less likely to develop fatal prostate cancer. 2/3 of the low-risk prostate cancer, you know, many times the doctor says, well, you have prostate cancer, but it's a very low grade, it's slow growing, it's low risk, you will probably die from something else. Thousands of American men hear this every year. If you take your vitamin D, they were able to show it completely stalled the progression of that cancer in the majority. 4,000 units a day help to stop the progression of that low-risk cancer. Skin cancer. Patients who avoid the sun, i.e. low vitamin D levels, are 3 times more likely to be deficient in vitamin D. And every skin cancer patient I've ever met, with good reason, I understand, avoids the sun like the plague. But they're not taking vitamin D. We need to do that. Here's what the Finnish researchers found. If we doubled our sun exposure, it would save 10 times the number of lives lost due to skin cancer. We have known for over 100 years those with skin cancers on the outside have lower rates of internal cancers. Vitamin D. We have more when we return.
I'm Cindy Becker.
And I'm Dr. Richard Becker. Are you thinking about your health as we approach a new year? Well, many of us do, even though our health is important every day of the year.
If you have a wellness plan in mind, December's a month with special holiday prices. Plus, shipping within the continental U.S. is free for all orders over $50.
We'd like to thank you for your continued support. It's because of you that we are able to provide this great educational service.
So call us today to restock your supplements for the coming year and tell a friend about the savings, or order online at bioinnovations.net for the best prices of the season.
We hope the new year brings you happiness and better health for your entire family. Merry Christmas.
And a happy, healthy new year.
I'm Dr. Richard Becker for Your Health at a Glance. Does acid reflux keep you hooked on antacids? If so, you may be suffering from GERD, which stands for gastroesophageal reflux disease. GERD affects at least 20% of the adult population. In fact, Americans spend hundreds of millions of dollars per year on medicines to treat GERD. This is unfortunate because these medications have side effects. They can cause additional digestive problems, and they lead to nutrient deficiencies, such as the depletion of vitamin B12. Fortunately, there are simple lifestyle changes that can reduce the symptoms of GERD. Avoid lying down or exercising within 2 hours of eating. Lose weight because obesity worsens symptoms. Limit foods that cause GERD, such as fried, fatty foods, mints, chocolate, and caffeine. To improve digestion, eat a diet rich in fiber, yogurt, and drink lots of water. For Your Health at a Glance, I'm Dr. Richard Becker. Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-pack. And remember, it's 50% off by the case. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. We're back, everyone, talking about the importance of vitamin D. And to help you get that vitamin D, don't forget, it is holiday savings time at BioInnovations. Great time to get what you need to stay healthy, best prices of the season, and free shipping on orders over $50 in the mainland USA, so that's a great time to stock up on your D3. So, Richard, we've covered a lot of material. There's just so much more. This is just great.
There is.
Now, what about vitamin D and our immune system and immune function?
Well, remember, vitamin D is also a hormone that controls our immune system. So the effects are profound. Now I'm going to read you a basic summary of how vitamin D affects our immune system. Then I'm going to tell you in layman's language, everyday language, what I meant by that. Okay, here we go. Vitamin D activates monocytes, macrophages, and T cells. What that means is our entire immune system is presented on alert when vitamin D is abundant. It controls the whole thing. Next, improves cell-regulated immunity, inhibits needless lymphocyte, immunoglobulin, and cytokine proliferation and synthesis. That means it controls our autoimmunity. That means that we don't react to our own tissues inappropriately. When that occurs, it's called autoimmune disease. We don't want that to happen. Vitamin D controls that. Vitamin D inhibits type 1 cytokine secreting T helper response while activating T helper 2 response. What this means is we don't have allergies so bad. You know, we shouldn't be reacting to pollen in the air. It's not going to infect us. Why do we react to that? That's an exaggerated immune response that can be calmed with vitamin D therapy. That's its job. It promotes timely apoptosis, or the death of cells. Cells should not live forever. When they do, when they try to live forever, we call it cancer. And when that cell dies, we call it apoptosis. And vitamin D regulates that. So that's your cancer prevention. Modulates appropriate immune response, transcription factor activation. Right response for the right problem. Let's say I get a bladder infection and all of a sudden I develop profound arthritis throughout my whole body. Well, I should be focusing my immune system on the bladder, and it shouldn't be causing arthritis throughout the body. That means we're controlling the immune system, doing just the right response for the right job. It's directed appropriately, and it doesn't trickle into an autoimmune reaction. And vitamin D controls inflammation just enough to get that inflammatory response to speed healing, but not to initiate suffering, such as an asthma attack and this type of thing. Deficiency disturbs this immune balance, promoting autoimmune disease. This is through misdirected killer T cells. And what happens is when we're low in vitamin D, you're at much greater risk of multiple sclerosis, inflammatory bowel disease, rheumatoid arthritis, insulin-dependent diabetes, and inflammation that can result in diabetes type 2 and its complications. Okay. A study of 187,000 found those with the highest levels of vitamin D had 40% lower risk of MS, and their children had a lower risk of MS. It's that powerful. Half of all patients with rheumatic diseases, autoimmune diseases, are deficient in D, and one type in particular, systemic lupus erythematosus, lupus. 99% of these patients, according to one study, are profoundly low. It doesn't have to do this way. Just 2,000 units of D3 a day calms that inflammatory reaction. I want you to take a little more than 2. We can do better than that. Autoimmune disease. Now we have a basic understanding. Vitamin D controls the entire immune response. Cardiovascular disease. University of Colorado found seniors with low vitamin D levels are 3 times more likely to die from heart disease and 2.5 times more likely to die from any cause, even car accidents. When you take all the deaths, lump them together, 2.5 more times likely to die from any cause. As little as 400 units a day will improve your lipid profile, lowers your cardiovascular disease risk. Deficiencies in D, in perspective to cardiovascular disease, stiffer arteries. If you're low in D, stiffer arteries, clogged arteries, poor vascular, each one of these is a study. I'm not making this up. I'm not that creative. If you are low in D, poor vascular function, higher cholesterol level, 40% more likely to experience ischemic heart disease, that's angina, 64% more likely to have a heart attack, 66% more likely to have high blood pressure, and it's typically salt sensitive. Salt makes you retain fluid, up goes the blood pressure. Think vitamin D. 64% more likely to have peripheral artery disease or claudication. 64% more likely to have muscle pain on statins. You know, middle-aged men, if you've had a heart attack, it's in your interest to take a statin drug. That's the one group who truly does benefit from them. But perhaps you found it makes your muscles hurt so bad you just can't take it. If you take vitamin D at higher levels and CoQ10, you may be able to take advantage of the protection statin drugs provide you. But you need that vitamin D so you don't suffer side effects from the medicine. If you're low in D, you're 81% more likely to have a fatal cardiac event and 300% more likely to, ladies, have postmenopausal hypertension, high blood pressure. Adding 2,000 units of vitamin D3 to your statin drug will reduce your cholesterol 29 more points and triglycerides 37 more points. Here's a very interesting one. 4,000 units of D3 a day lowers blood pressure systolic about 4 millimeters. 1,500, 1,500 international units did not lower blood pressure. 7,000 units a day, if you're a large guy like me, 220 some pounds or so, it'll lower your blood pressure 11 systolic and 4. diastolic points. Essential hypertension, in my humble opinion, is nothing more than vitamin D deficiency. Millions of Americans have essential hypertension. It's been called the #1 health threat in America by many health experts, and in my opinion, is nothing more than vitamin D deficiency. Can you imagine the billions of dollars we could save, the suffering we could prevent in heart disease alone if we all just took a 10-cent pill? And yet, no politician has mentioned vitamin supplementation in the Affordable Care Act. It's not a part of it. You're going to have to do it. We have a break. We have more when we return.
I'm Cindy Becker.
And I'm Dr. Richard Becker. Are you thinking about your health as we approach a new year? Well, many of us do, even though our health is important every day of the year.
If you have a wellness plan in mind, December's a month with special holiday prices. Plus, shipping within the continental U.S. is free for all orders over $50.
We'd like to thank you for your continued support. It's because of you that we are able to provide this great educational service.
So call us today to restock your supplements for the coming year and tell a friend about the savings, or order online at bioinnovations.net for the best prices of the season.
We hope the new year brings you happiness and better health for your entire family. Merry Christmas.
And a happy, healthy new year. Talking about the sunshine vitamin, vitamin D3, makes me think of other ways to bring a little sunshine into our lives. The often quoted columnist of Pertinent Proverbs, William Arthur Ward, once wrote, "A cloudy day is no match for a sunny disposition." This echoes what Solomon said in Proverbs 15:30. A cheerful look brings joy to the heart, and good news gives health to the bones.
Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why BioInnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Again, that number is 888-442-2128. Call today. Ask about the AutoShip program for additional savings. We're back, everyone, talking about the importance of supplementing with vitamin D3 for your good health. Now, Richard, what about the neurological effects of not getting enough vitamin D?
Vitamin D is involved in preserving good brain function and good health. If you're low in D, it increases your risk to poor response to antidepressant drugs. If you have major depression, you add vitamin D to your SSRIs, your Prozac class, you're going to get a better response. We know if you're low in vitamin D, you're much more, 3 times the risk of Parkinson's disease, 70% more likely to develop Alzheimer's disease and other neurodegenerative diseases. Vitamin D, add a little fish oil to that, B complex, B12, curcumin, magnesium. You can protect your neurologic status. You can stay strong and smart, the vast majority. You know, we can't prevent all disease, but we're talking huge numbers here in prevention. This adds up to great benefit for many, many people. One that's very important, I wish we could do all of these, but if you are taking seizure medicine to control epilepsy, These medicines deplete vitamin D. When you are profoundly low in vitamin D, it causes seizures. Can you imagine? I know there are people listening, watching right now who are taking 2, 3, maybe even 4 medicines to control their epilepsy when really what they need is vitamin D. Think about that for a while. Your medicines are working against you. Get it checked. Take the appropriate dose. Musculoskeletal health. We learned in our news today that both men and women, when we're low in D, we're much more likely to have chronic and severe intractable pain that affects our quality of life. Wake Forest, vitamin D under 30% more likely to have mobility issues. You're unable to care for yourself. You can't get around. You're disabled. 3 out of 4 hip fracture patients are low in D. Half of all patients undergoing orthopedic surgery are low in vitamin D. Surgeons recommend at least 2,000 to 4,000 international units a day for 6 weeks prior to elective surgery. I recommend a little higher than that for most people. Over half of all spinal fusion patients are so low in D it will compromise their ability to heal and their satisfaction in their surgery. You know, this is the person who had the spinal fusion and 6 months later said, "It didn't help me. I'm still in pain. I wish I'd never done it." Well, it's not the surgeon's fault. It's because you are low in vitamin D for at least half of the people. Isn't this startling? Startling, and people are living in chronic pain because of this. 80% of those presenting to the emergency room for emergency orthopedic surgery. You're in a car wreck, you fall off the ladder, it's an emergency, I need a bone pinned, quick, I'm miserable. 80% are so low in vitamin D, it will compromise their ability to heal. That's how you become a chronic pain patient, okay? When we're low in D, seniors, your proximal muscles, your core strength muscles, those muscles that keep you up and strong get weak. You fall down, you break hips, you break legs, you break wrists. 4,000 units a day given to elderly patients improves their muscle strength and size, but what's interesting here, they gave 10,000 a day to healthy young men, and it did not increase their strength. This is an important point. Vitamin D is not an anabolic steroid. If you're low in D, you will be weak. Supplementing D will increase your strength, but taking high amounts, huge amounts, does not have an anabolic pump you up type of effect. This means we're not getting side effects because anabolic steroids can actually kill you. The side effects are severe. We don't want to mess with that. We want natural strength, and that's what vitamin D provides. Let's talk a little bit about vitamin D in pregnancy in children. 7 out of 10 pregnant mothers in this country are low in vitamin D. 7 out of 10. They're afraid to take it. It might hurt the baby. That is nonsense. When you are low, mothers, when you are expecting, you are much more likely to have genitourinary infections that lead to premature delivery. Low birth weight babies is a complication of vitamin D deficiency in pregnancy. And where do those babies go? To the neonatal intensive care, not to your bedside, not with you in that critical bonding period. Think about this. Low birth weight babies, vitamin D connection. Stunted growth and development. Unbelievable. Children taking 1,200 units of vitamin D are 64% at less risk of influenza, 50% less risk of upper respiratory tract. Remember in our family practice days, kid after kid after kid with snotty, runny noses, earaches, we could cut that in half just by giving vitamin D to the little ones. And they are tragically low in it and they need more. Let's talk a little bit about diabetes. Type 2 diabetes and low D, 95% increased risk of premature death. If you're a type 2 diabetic and your vitamin D is low, that's 100% increased risk of death this year just because you're not taking a 10, 20-cent pill every day. It's tragic. 95% of us, healthy people who maintain a high normal level of vitamin D, never go on to develop diabetes. 95% protection. Review of relationship, the higher your vitamin D level, the less likely diabetes type 1 or type 2 even develops, even gestational diabetes. American Journal of Clinical Nutrition, 100,000 units over 42 days. That's basically 2,500 international units a day for the diabetic. Reduced fasting blood glucose, insulin levels, low density lipoprotein, your cholesterol, total cholesterol dropped, along with markers of inflammation. Diabetics, you will have an easier time managing your diabetes. You'll have fewer complications. You'll feel better. You'll be more active. Your weight will come down. All of these things slowly but incrementally with the surety if you get your vitamin D level up. Lower foot complications, diabetic ulcers. I mean, we can go on and on. Let's do this, folks. Let's go to our break a little early. And when we return, let's give you concrete instructions on how to take vitamin D when we return.
Hello, I'm Cindy Becker.
And I'm Dr. Richard Becker. Are you thinking about your health as we approach a new year? Well, many of us do, even though our health is important every day of the year.
If you have a wellness plan in mind, December's a month with special holiday prices. Plus, shipping within the continental U.S. is free for all orders over $50.
We'd like to thank you for your continued support. It's because of you that we are able to provide this great educational service.
So call us today to restock your supplements for the coming year and tell a friend about the savings, or order online at bioinnovations.net for the best prices of the season.
We hope the new year brings you happiness and better health for your entire family. Merry Christmas.
And a happy, healthy new year.
I'm Dr. Richard Becker, and this is Your Health at a Glance. Our health depends on the choices we make every day, and few conditions are as dependent on our choices as diabetes. So here is your daily diabetic checklist. Number 1, take your diet seriously every day. Eat lean protein and leafy vegetables. Number 2, sugars and starches raise blood glucose, so reduce them in your diet. Number 3, check your blood glucose and record the readings every day. Number 4, take your medication daily and don't skip. And number 5, try to exercise every day. It will help you take off weight, which will help your body regulate blood sugar better. If you are diabetic, this is your quick daily checklist that could make life better. For Your Health at a Glance, I'm Dr. Richard Becker. Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient. Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
BioInnovations brings you Dr. Becker's BioNutrients Vitamin D3. Now, supplementing with vitamin D is safe and affordable.
Studies show that vitamin D deficiency can lead to poor immune function, depression, cardiovascular disease, bone disease, diabetes, cancer, and much more. Starting supplementing vitamin D today for better health tomorrow. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Your Health is brought to you by BioInnovations, trusted products for your health and well-being. We're back, everyone. Okay, so Richard, how do we get our vitamin D up to that level so we can get the protection that we need? Well, let's give the guideline dosages for everyone so they can calculate their own vitamin D dose. Let's do it in pounds since Americans use the American English system more frequently. 30 to 35 international units of vitamin D3 per pound per day. Now the range 30 to 35, 30 is for a small person, thin, slight framed, and the 35 is up to big persons like an NFL linebacker, you know, big, strong, big man. If you are obese or you take a medication that depletes your vitamin D levels, you need to add another 1,000 or 2. The absolute best way to determine your vitamin D dose is to do serial blood levels and check to be sure what your dose is creating in you. That's the best way to do it, but I live in the real world with all of you too. I know we can't all do that, but we can have a starting place. In kilograms, it's 65 to 75 international units of D3 a day per kilogram per day. Now, the next thing is some people should not take extra vitamin D. Who is that? Well, if you have a dramatic increase in your blood's calcium level, you need to be exceedingly careful about vitamin D therapy. You need to depend on your doctor's advice because with vitamin D, it can raise that blood calcium level. And high calcium levels can lead to death. We don't want that to happen. So if you have a disease that raises blood calcium level, only do what your doctor tells you to do with vitamin D therapy. An example of that would be hyperparathyroidism. Work with your doctor. You still need vitamin D, but it's in small amounts. Also, there's a group of cancers. It's called multiple endocrine neoplasias. There are some cancers that make hormones that raise calcium levels in your bloodstream. Work with your doctor on your vitamin D dose. Also, there's a condition called sarcoidosis that causes an increase in calcium levels. Now, that has come into question. They're researching right now whether vitamin D therapy really does raise the level of calcium in sarcoidosis, but until we know, work with your doctor on your vitamin D dose. Let me give you some facts. 10 30-minute tanning bed sessions over 30 days is equal to 60,000 international units. Okay, give you an idea here. If you sit out in the summer sun in a swimming bathing suit just long enough to get pink. For most white people, that's 20 to 30 minutes. If you have darker complexion, it may be a little longer. If you do this in the sun till you're pink, you make 10 to 25,000 units. So don't be afraid of a 5,000 a day dose. Nature makes that way more than that just with a little sun exposure. If you're off vitamin D for 30 days, your blood level will drop below 20 into the tragic rain. Don't let that happen. Don't run out of your vitamin D. If you take a huge dose of vitamin D, say 250,000 units, it only protects you for a few weeks. It doesn't work out to average for every day. Don't fall into that trap where I'm only going to take this twice a year. I'm going to take a big dose twice a year. You won't get protection every day of the week, every month. It's better. You could do weekly. We can do weekly. Weekly doses help to make things a little easier to remember to do this. The best really is day to day. We're finding that out from current therapy. Infants need 800 international units, and adolescents 2,000. By the time they're 18, it's an adult dose that we gave you, 30 to 35 international units per pound per day. Well, I hope we helped to clear up some controversy on vitamin D. And I promise, folks, I will keep championing the cause until the majority of Americans are taking vitamin D. Can you imagine the suffering spared? That will be a great day indeed. Thank you for your kind attention. We'll see you tomorrow, folks, right here at Your Health.
Thanks, everyone. We'll see you tomorrow.
In the pit of my stomach, I knew it was going to be positive. I wouldn't be in this situation if I would have even been taking it if I didn't think it was going to be positive, but I didn't want to admit that. I turned it over, and there were 2 lines. It was a positive test. I remember just being like, oh no. Like, that was all that really went through my head. I didn't know what to do.
Hear the stories and experience the freedom on Real Life.
This week on Our Jewish Roots, we begin our examination of the kings of ancient Israel and Judah in our series, Kings and Kingdom. With dramatic reenactments, Bible teaching from Dr. Jeffrey Seif, watch for Kings and Kingdom.